All right. Good afternoon, or I guess good morning. I'm Bob Ravenscroft, the Vice President for Advancement. I want to thank you all for taking time to join us today. Obviously, those on a healthcare beat, it's a busy day. So I know members of the media saw the joint statement by some of the large health systems in the state of Nebraska today. I'm not going to go through that again since you just sat through a call with all the chief medical officers. But I do want to open up with a quick kind of apology to Matt. A couple of weeks ago, you asked about the requirement for vaccinations, and at that point I said we were most likely going to tie it to the FDA lifting the emergency use criteria. That was indeed our intention at that time, but as you saw from the previous press conference, collaboration and coordination with all of the other organizations, that it just remains so vital as we navigate this pandemic, and we've been working collaborative as a state. So that's why we upped it. And also the processes in place for our employees will span that expected lifting of the EUA that is coming most likely in weeks rather than months at this point. Worth noting, and it was also on the previous press conference, we also felt confident doing that because we're no longer at the safety and effectiveness of the vaccine stage through the FDA approval process. It's all about supply chain and storage and distribution, those final things that they need to take clear of. Before we get into the daily stats, today I have with us the Chief Executive Officer of Bryan Health, Russ Gronewold. We have Dr. Sian Jones-Jobst from Complete Children's Health, and Dr. Matthew Wittry, a pediatric psychiatrist from Heartland Psychiatry. So let's go right to some announcements. The vaccine is readily available. It's easy to get. I applaud you and thank you for continuing to make this information available to our public. People following on social media, here's how easy it is for people to get the vaccine and get their doses. Important to note, we believe in this. A little over 84%, actually it's about 85% since this slide was last updated of our employees are vaccinated, and 95.5% of our employed physicians at the time of this slide, which was produced last week, were already vaccinated. As far as what's going on in Bryan right now, things continue to go in a direction we don't like. You've seen these slides, so you're familiar with them. Currently, we have 40 patients that are COVID positive. You can see most of them are still in Lancaster County. We have an additional 9 patients that are no longer infectious from COVID, but still require hospitalization. So butting right up against 50 patients. I know there were also 11 that look like they're COVID, just awaiting the diagnosis in our emergency departments this morning. As far as ventilators, you can see those that are kind of long stay patients that are no longer infectious. There's 5 of them. And then of our currently positive patients, there's 6 patients, so for a total of 11 patients currently getting mechanical breathing. Age breakdown, this was as of Monday. We pull this information every Monday. It's very consistent with when we shared this a couple of weeks ago. You know, about a quarter of our patients are now under the age of 50, and then if you go under the age of 65, which was a line of demarcation really on the last surges, you know, it's well over half of our patients are skewing much younger than they were before. As far as vaccination status of those patients hospitalized under the age of 50, 100% are unvaccinated. And then for those over the age of 50, 22 of them have completed their vaccination cycle. Very frail individuals that the vaccine wasn't quite enough. But you can see the vast majority are also unvaccinated over the age of 50. This, you guys are all familiar with seeing. The gray represents our daily census. We remain very busy. If you go over to the far right side, you see the growth since the 30th of June, you know, doubling or almost doubling or more than doubling essentially every couple of weeks. So it's something we're watching real closely. What I do not have a slide for is the number of people we've unfortunately lost. On the 7th of July, we had experienced 238 deaths here at Bryan due to COVID-19. As of August 12th, that has climbed to 253. It is indeed a difficult time for our team, difficult days ahead. Real quickly, before I get to our guest today, Youssef and others have been asking a lot of questions about pediatric care. So I'm going to put a slide up quickly that came from the Center for Disease Control, and really pay attention to the one on the left. This is what is going on across the country for hospitalizations of youth due to COVID. And just look to the far right where you see that yellow line going straight up. A little bit about peds at Bryan. We have the capacity to handle, we have a 21 bed capacity, and that's technically 19, but if they're siblings, you can squeeze a few more out of it. They are classified as what are called progressive beds, meaning ICU level care has to be supported through telemedicine, through Children's in Omaha, or typically we transfer to Children's. On the earlier call today, I know that many of you heard the plight that this is creating. Children's, I know, has 132 beds, 29 of which are ICU beds. Boys Town has 14 general pediatric beds, 6 ICU beds. Nebraska Medicine, 15 general peds beds, 7 ICUs. I'm not quite sure where CHI is on this, but I think that begins to illustrate even a handful of pediatric patients requiring hospitalizations can send a ripple effect throughout. All modeling shows we're just several weeks beyond what's going on in the southern part of the United States. A little bit more, and Dr. Jones-Jobst was sharing a story with me before we started. Our team of pediatric hospitalists, ICU, respiratory therapists, and anesthesiologists and the like, they talk every day, and they coordinate with Children's every day, and other overflow locations, Omaha, Kansas City, Des Moines are essentially full, and on this morning's call, there was 1 PICU bed left in Denver. So there really isn't a regional relief. And I know that Dr. Jones-Jobst will talk a little bit about what they're seeing in the pediatric population that does not require hospitalization. Again, there was a big joint announcement today. So with further ado, I would like to bring Russ Gronewold, Chief Executive Officer of Bryan Health, up.
Well, good morning. We did join with other leading systems across the state today to make COVID-19 vaccine a condition of employment going forward at Bryan Health. COVID will now be a required vaccine along with 9 other vaccines that we've always required for employment, things like measles and mumps and so forth. So this will now become the 10th required vaccine at Bryan. I just think it's important to remember when we talk about vaccines from my vantage point, I think from all our vantage points, it's the single greatest intervention ever invented to save life and disability across the world. And there have certainly been lives lost, 600, 700,000 Americans, disabilities from COVID-19. Vaccines are important to the overall health and have always been to the overall health. This is similar for COVID-19. We will have exemptions for deeply held religious convictions and certain medical exemptions, and so we will honor those, as is everybody else in their different ways. I'm sure that this will look a little bit different at each of the places, but at the end of the day, there will be some religious and medical exemptions. One of the things we know for sure is this vaccine's safe, and I know the EUA hasn't been lifted, but we know the safety of it because it's been administered to hundreds of millions of folks across the world. It's been administered to our staff. It's been administered to our physicians. In all of the cases, the symptoms, or the side effects, I should say, of the vaccines have either been non-existent, mild, and just very rarely have we had a medical intervention, and those were always brief and precautionary without further side effect. So the fact is that these are safe, and that really compels us that now is the time in this new wave of the Delta variant to begin to require this going forward. But at the end of the day, ultimately, this isn't about a vaccine. This is about the safety of our community. It's about the safety of our colleagues. It's about the safety of our patients. Now, we've been able to keep folks very safe with the interventions that we've used, masking and hand washing and distancing and all of those things. Folks have been very safe here, but this is the gold standard. By having the vaccine along with those other interventions, we know that we're doing everything we can to keep our patients safe. But with the Delta variant surging, we also know now that the rest of us, even if we're vaccinated, can be asymptomatic. And that begins to create other issues. And so we have colleagues who are saying to me, hey, I'm going through my own health events. My son or my daughter are going through their health events, and I'm scared for them or I'm scared for myself. And this allows us to keep our own colleagues safe as well. At the end of the day, the surge that we're seeing, it's unnecessary, and it could have been prevented. And so from our vantage point, this is the time where we have to take this step to be as safe as possible for our patients, as safe as possible for our colleagues and their families, and to do everything that we can as a leading citizen of the community to make sure that we're helping stomp out the current surge of COVID-19. We want everybody to stay here at Bryan. There's not one person at Bryan that we want to leave over this matter, and so we're going to be making an incredible amount of education available to our staff in order for them to counter or to understand what that looks like relative to maybe the misinformation that they've had over time, or maybe they're really struggling to apply it to their particular situation. We want to make sure that we're counseling them well so we can get them into a situation where they can stay here. For those that have legitimate exceptions and exemptions, well, we will be requiring formal declinations, masks, and ongoing testing, regular ongoing testing as we move forward. But again, it's our goal that we get that number from our 85% of our employees now to 100% or as close as possible, except for those very few legitimate medical and religious exemptions.
It was fascinating in the prior press conference today to hear the chief medical officer from Children's present from his perspective. And all of the line of questioning was along hospitalization. So I'm going to bring up Dr. Sian Jones-Jobst, again from Complete Children's Health, to talk about what's going on in the pediatric community that might not quite be requiring hospitalization yet, and advice for families as you get ready to go back to school and keep your family safe and protected. Sian?
Hopefully that's in the right position there. I'm a little bit shorter than everybody else here. So, well, I appreciate the opportunity to be here today. I think from my perspective, I agree with what Russ was saying, which is we're in the middle of a completely preventable surge of COVID-19. I'm a pediatrician, and I practice in general outpatient medicine, and we are seeing COVID in our clinic. 6 weeks ago, we weren't seeing much COVID in our clinic, but since about 6 weeks ago, we started getting phone calls about outbreaks in camps, outbreaks in daycares, family members coming home from trips who are positive for COVID, and kids who are exposed. And that's when we started to see a little uptick again in COVID-19 infections. We test in our office, and we follow our COVID-19 percent positivity, and our percent positivity has pretty much matched what we're seeing in the community for percent positivity. So the last time I checked was about a week ago, but we were somewhere between 8 and 10% positivity for COVID testing in our office. So kids are catching COVID, and unfortunately with the Delta variant, we are seeing kids who are ill, and we're seeing more complications. I think, unfortunately, there's a myth out there about COVID-19 being completely benign and irrelevant in the pediatric population, and that is not the case. Although we don't see the same numbers of hospitalizations and ICU admissions for patients with COVID-19 who are in the pediatric age group, we do see some. We have had patients who have been sent to Omaha back during our original surge with MIS-C, which is a multi-system disorder that occurs post-COVID infection, so several weeks later. We haven't seen that here yet that I know of in Lincoln. However, we won't expect to see that for several more weeks because it is a post-COVID-19 infection complication. Some of the kids with MIS-C didn't even have significant disease. They might have had mild cold symptoms, and then later on develop this multi-system inflammatory syndrome. So it's important to remember that kids are not completely safe from COVID-19. The other things that we see in COVID-19 infections in children and adolescents are maybe not things that make it to the media, but things like long COVID syndrome, where patients have almost a chronic fatigue-like syndrome, muscle aches, weakness, heart dysfunction, lung dysfunction, fatigue, brain fog, cognitive slowing, depression. And for those adolescents that we're seeing that are suffering from that, these symptoms go on for months, and some have still not resolved. And so as we see more cases of COVID-19, we will see more cases of long COVID. We have a safe and effective vaccine for COVID-19 that is authorized for use down to 12 years of age. I have an 11-year-old and a 13-year-old at home. My 11-year-old is not old enough to have the vaccine. My 13-year-old was vaccinated in May when it was first authorized. It's a relief to know that she can be vaccinated. Unfortunately, we know also that with the Delta variant, because patients seem to have a higher viral load, that patients who are vaccinated can still get COVID and pass COVID. They are safe from severe infection, and they do not typically get hospitalized unless they have underlying medical conditions. But COVID-19 still can be spread after vaccination. That being said, not to the same extent as someone who is unvaccinated. And so vaccination is our best tool against spread of the Delta variant and worsening conditions in our community. I have colleagues in Kentucky and Arkansas and Texas, and the situations that they're dealing with right now in regards to COVID-19 are serious, and I don't want to see that happen here in Lincoln, Nebraska. One of the other things that we're dealing with currently in Lincoln and in the Omaha area and in Nebraska in general is a respiratory viral surge that we typically don't see until November through February of each year. We're seeing a lot of RSV bronchiolitis, a lot of other respiratory viral illnesses, and a lot of children requiring hospitalization. And because of that, we don't have beds for patients when they're sick. And so when we start to see cases of MIS-C, when we start to see cases of perhaps co-infection with both RSV and COVID-19 in infants and severely ill patients, we're going to be in trouble. I was nervous yesterday when I got an email from Bryan talking about surge planning for pediatric beds if and when we fill. And I don't want to see that happen to our patients. If we don't have a place to send ill patients, oftentimes we are stuck sending them out of state, far away from family, and we don't want to get to that situation. So I think the one other thing that I will mention is I cannot overemphasize the importance of other layered protection. Vaccination is our best bet. It is safe. We offer it in our office. I wouldn't give it to my patients or my own child if I didn't know it was safe and it worked. But masks work too. Masks are safe, and they are another layer of protection against transmission and infection. So I encourage everyone, if you have questions about COVID-19 vaccination for your child or for yourself, please get more information from your healthcare provider. They're happy to answer your questions. I know we get those calls. We have those discussions in the office all the time, and we're happy to answer any questions you have specific to your child or yourself as well.
All right, next will be Dr. Wittry, again, a pediatric psychiatrist. I'm really looking forward to this because we all know how polarizing elements of our community are on this, and he's going to speak a little bit to, how you can help prepare your children and things to identify and other things. So, Dr. Wittry.
Good morning. Thanks, Bob. I appreciate the opportunity to be here and engage in this important conversation. I'm a child and adolescent psychiatrist, and I hope I can provide some relevant thoughts on some difficult topics because of where we're at in our current state of things. right now, as we prepare for kids to go back to school, I think we, as parents or caregivers or adults in the community, we recognize that transitions are difficult. They're difficult for all of us. I'm almost certain that this is going to be a particularly difficult transition for a lot of our youth as we go back to school this year. And that's because of COVID and all the downstream effects therein too over the last year and a half. From a mental health standpoint, the effects of COVID and those downstream effects have been staggering. Depression and anxiety rates are skyrocketing. Substance use prevalence is increasing. Suicidal ideation, suicide attempts are increasing substantially. There are two things that I can think of that are trending downward, and unfortunately, those are troubling. The things trending downward are CPS reports for abuse and neglect, certainly not likely because of decreased occurrences, but because of decreased interactions with adults outside the home. The other thing that's downtrending is access and utilization of mental health services, either because of difficulty in continuity of care because of changes, or workforce personnel issues, or parental concerns with regard to COVID. I don't think there are any foolproof, perfect answers or solutions to transitions. If I could offer a couple suggestions, it would be these. First of all, I think if we as parents or caregivers or adults, if we can empathize and normalize, that can be extremely helpful. Empathize means listening and acknowledging the difficulty with transitions. Normalizing is talking about how transitions bring about uncomfortable emotions, that we as adults experience that it's likely that a lot of kids' peers experience some of the same things. If we can empathize and normalize without minimizing or without maybe jumping to try and fix things, that can be very beneficial for our kids. Secondly, I'd say communicate. If you can engage in dialogue, not once in a while, but every chance you get, that's so incredibly important. Asking questions, being pesky, not letting that eye roll or two stop you from continuing to engage in conversation, and attempting to model moving past maybe some of the more superficial things. Just instead of talking about events, moving past to modeling, talking about emotions. And the last thing I would suggest is trying to continue to be vigilant. Not being hyper-vigilant. We know that anxious environments or anxious parenting begets more anxiety. But instead, there's that fine line, instead of hyper-vigilance, being persistently vigilant. Being observant, engaging with kids, and looking for signs of dysfunction. That's not an isolated event of, say, a difficult afternoon or irritability or a temper outburst, but patterns suggest dysfunction. Changes in affect or how an individual carries themselves, or potentially decreased motivation or decreased energy, increased irritability, behavior changes, things like that may suggest things are particularly difficult and again leading to concerning dysfunction. And on that note, having a readily employable plan as far as what the next steps are. How do we access frontline personnel with through primary care or looking to school and community resources? making sure kids know about resources available, suicide prevention hotlines, allowing them to feel comfortable to ask for help, to see a therapist or a psychiatrist for an evaluation or follow-up. Those can be very important things and hopefully help with that transitional aspect that we're going to continue to experience as we go through going back to school, but also the ongoing difficulty with these uncertain times. Thanks.
Okay, we will open it up for questions. The first one came in with school starting. Vaccines not available to those under 12, and only about half of those from 12 to 18 vaccinated. What's your level of worry about potential surges in pediatric cases? I'm going to pull Dr. Jones-Jobst up here. From a Bryan perspective, I think it's fair to say with the surge planning that was referenced, there's a level of concern. Again, we have only 3 open pediatric beds right now at a pretty high level of care, not ICU level of care. Currently, there are 0 COVID patients, thankfully. But as Dr. Jones-Jobst said, it's appearing in the outpatient setting, and with what's going on down south, we hope, because I think we personally fail as a society if we don't protect our kids, and you see what's happening down south, and we hope we're wrong, but it looks like we have something coming.
I think that's a good point and a great question. So I mentioned before, I have a 13-year-old and an 11-year-old, and my 13-year-old is vaccinated and my 11-year-old is not vaccinated because she can't be yet. And we're hopeful that we will have a vaccine available sometime in the near future for children under 12 years of age, but at this point we don't. So those kids are at risk of infection, and they're going back to school. Now, what I will say is we did an excellent job in our community keeping our kids in school and keeping them safe last year, and that was without a vaccine. I have a nephew who's in California, and he was not in school last year. That was how they managed it. And here we kept kids where they needed to be in school. And I truly do believe that is what we need to try to make our number one priority for our youth, is keeping them in school. I would guess Dr. Wittry agrees with that. It's good for their mental health, and they can't learn as well at home. We did that with masking. We did that with social distancing. We did that with cohorting students in elementary school. We did that with barriers in the lunchrooms. We have some of those things in place now, and I am hopeful that we will not get to a point where we need to reinstitute any of those things. But I think if we've learned one thing from COVID, it's that we have to be constantly nimble. Things change, and we have to be willing to adapt and stay ahead of things. And so I am concerned about young people catching COVID because they're not vaccinated. I do think that masking in the school is a helpful layer of protection, and I would encourage parents, if you have a child under the age of 12 who's not vaccinated, or anyone in your household who's at high risk of complications of COVID-19 infection, everyone in your household should mask when they're in public, and that includes students in school.
Before we move to the next question, Dr. Wittry, do you have any advice for the parents who are going to be masking their kids, and how to cope with potential harassment that they might face, and what you could tell the parents to do for their kids?
That's a good question. I don't think there's an easy answer or easy approach. I certainly would echo the sentiment that it's imperative for kids to be in school. Consistency and structure are vital from a development standpoint. The school setting and what's accomplished at school is so helpful in building a foundation that's that continues to help kids throughout their childhood, adolescence, and into adulthood. With that come really difficult questions about measures that are undertaken to keep kids safe and to allow them to continue to be in school. I think it's okay for parents to communicate the fact that there, especially in these circumstances, there are not obvious right or wrong answers, categorically right or wrong answers. Instead, everything is on a spectrum. And if we can weigh the totality, I'm not trivializing any of these decisions, but I also want to encourage parents and caregivers that we weigh risk versus benefit all the time, not only in the medical field, but again as parents. And if we can look at things in totality as far as effects and do the best we can with the information that we have and continue to ask hard questions, continue to use evidence-based approaches, and continue to be nimble, that affords us the best opportunity or the best likelihood we have to proceed. Again, I think a lot, going back to the particular question about how individuals will be portrayed either for wearing masks or for not wearing masks. I mean, certain things are so polarizing right now that I think it's really important, one, to offer an avenue for kids to talk about what's going on, how they feel, and how it affects them, to invite them into those really hard conversations, and then lastly, as parents, to be able to truthfully say that sometimes we don't know, and that we have to do the best we can with what we have, and that things may change as we move forward.
Thank you. A couple more questions. Yusuf asked, why won't Bryan release pediatric COVID case numbers? I hope I must not have been clear, Yusuf. We have 3 pediatric beds currently open, and none of them are COVID patients, I said, thankfully. So there's nothing to release. Dr. Jones-Jobst just said that the positivity rate in her pediatric practice, which is a massive one that covers the whole city, 8 to 10% now? Yeah.
Last week between 8 and 10%.
Yeah, last week it was between 8 and 10%. Those are the numbers, Yusuf. We will continue every Monday to pull the breakdown by age, and you will know. On the CMO call today, I think they addressed that there are several in Omaha right now. Okay, yesterday 11 senators sent a petition to Governor Ricketts to reinstate the COVID-19 dashboard that the Department of Health and Human Services used to provide. As healthcare workers, what's your point of view on this petition? I'm going to ask Russ to maybe offer some commentary, but I can say that's why Bryan has resumed our daily reporting. We feel the community should be informed. I think that was echoed by the CMOs.
Yes, let me 2 comments about that. Number one, we need to have the dashboard back. And the reason we need to have it is simple. When we're trying to create confidence in a medical system and confidence in a response to something we've not been through before, the only way to do that is through complete transparency. And so that's necessary for the community to gain confidence. It's also necessary for an organization like Bryan to plan well. So when we look across the state, we take care of patients from 52 communities across the state typically. And if we don't know what's going on in those communities, some which are vaccinated, some which are active in trying to get interventions done, some which are not vaccinated and are not trying, if we can't be planning around if we can't be seeing that, we can't be planning around that. So it's really necessary for someone like us, an organization like us, to do the kind of work we need to make sure we can continue to serve those communities, not just here in Lincoln, but all across the state.
We're only 2 days away from a very large event in the upcoming Garth Brooks concert. What are some of the concerns the medical community has about this event, given that people are unlikely to not attend after buying tickets? What are some suggestions for safely attending this event. I'd say there's large concern. I think we were a little bummed that the tour was not going to be suspended until after Lincoln, but it's moving forward. Again, we have opened up 4 dedicated COVID units in the past week and a half. We're approaching 50 people, and you have a case rate doubling essentially every couple of weeks right now. Our suggestion for those still attending would be to mask if you're vaccinated or unvaccinated. Anybody else have anything? Everyone's head nod. Okay. I'd like to thank both of our physicians for taking time out of their busy schedule. Russ as well. Obviously, it's a busy day as the big health systems in Nebraska are communicating with their employees and responding to a lot of public commentary right now. So thank you from the bottom of our heart for your continued coverage and your continued sharing of the opinion of the medical professionals in our community. We are so fortunate for the caliber of the medical staff we have here. All right. Thank you, everyone.